Welcome. Programs designed to incorporate tooth decay prevention as part of the child's regular checkup with the doctor could be a big step toward improving infants' and toddlers' dental health. That's according to University of Florida researchers who received a grant from the National Institutes of Health to study whether such programs in Florida and Texas are actually improving dental care in young children who are enrolled in Medicaid. My guest is Dr. Frank Catalanato. He is a professor of pediatric dentistry in the College of Dentistry. Doctor, thanks for joining us today.
Good to be here with you.
Would it be safe to say that conventional theories, I guess probably by most people who are laymen, would suggest that a kid's baby teeth, you don't have to worry too much about that because they're falling out anyway, and that's a misconception, isn't it?
That's a major misconception. Those teeth are important for a variety of reasons. Just chewing food is one example, and for a child getting proper nutrition. And then guiding the permanent teeth into the right position is another very important function of baby teeth. So they are very important.
And there have been actual cases where we've had terrible outcomes because of a dental infection that was overlooked, right?
Yeah, that's one of the real tragedies of this very preventable disease. If a parent doesn't realize the child's tooth is infected and the infection goes too far, and then if they're unable to find a dentist that can take care of them, for example, if they're a Medicaid patient and they can't find a Medicaid, the parents can't find a Medicaid practitioner, we have had several deaths in this country from untreated dental infections, and we've had lots of hospitalizations. I mean, in Florida alone, in one of the years we looked, there were 1,200 hospitalizations in 1 year for a dental infection that had gone too far.
Mm-hmm. So I guess it's then one would assume that one should begin some form of dental care as soon as teeth emerge.
The current philosophy, and this is about 10 years now, that it's been nationally accepted by all the health care organizations that take care of children, is that a child should have that first dental visit at the latest by 1 year of age. My preference is when that first tooth comes in the mouth, which is about 6 months of age. Mm-hmm. So the parents can get the right advice about what to do. They can start brushing with a fluoridated toothpaste, and then if they're a high-risk child, the dentist can apply fluoride varnish, which is a wonderful preventive agent.
Should, for example, a child in this age group, say in the age of 2 or 3, who's got a full set of baby teeth, would they need periodic cleanings?
They would need a cleaning, but our recommendation is that the kind of cleaning that would be done is not what we see in adults frequently, which is with a rubber cup, a pumice prophylaxis, but just a toothbrush cleaning with a fluoridated toothpaste is all that we recommend and all that we do.
Talk a little bit about how this affects then later on when the permanent teeth emerge. Is there a noticeable improvement overall, do you think?
Well, yes. So the data that we know about right now says that high levels of caries in the baby teeth in the primary dentition are a good predictor of the dental caries level in the adult dentition. So that's one of the very logical reasons why you want to prevent the disease early on. One of the other factors in the young child is that the caretaker, the mom and the dad, if they have high levels of untreated cavities, that means they've got lots of the bacteria associated with cavities. That's a bacteria called Streptococcus mutans, and that gets transmitted to the child. And that's how this disease gets initiated. Mm-hmm. There's not much you can do about the transmission, but you certainly can do something about the other risk factors like the diet, whether the child is on a bottle, whether the child should not go to bed at night with that bottle unless it has only water in it. And that's part of the simple advice you need to try to get to parents.
Okay, and taking this further, because of the economic climate in this nation right now, it's safe to say also that many people are putting off or at least delaying routine dental care. This kind of early prevention can actually prevent some big medical costs, couldn't it?
Well, medical and dental costs, and there's some very clear studies right now that show that the earlier you start the prevention, even though you're going to incur some costs for that, the lower the long-term costs are for taking care of that child. So there's very clear evidence right now, and that's why the states are doing this, why they're reimbursing medical providers now to provide these early childhood caries preventive procedures.
And finally, can you talk about some of the aspects of this study, which is ongoing now?
Well, okay. So what we wanted to look at in this particular study is that we've had this physician reimbursement in Florida and in Texas since about 2008. And one of the steps the physician is supposed to do, in addition to the exam and the risk assessment and applying the varnish and the parental education, is to try to make a referral to a dentist, to get that child to a dentist as early as possible. We're going to look at whether, in fact, that's actually occurring. Are the kids getting to the dentist? Because obviously, the physician can only do preventive care. They can't do the definitive care that we dentists can do. So we're going to look at the factors that are influencing whether or not the kids are actually getting to the dentist. And the results of that will help us make policy recommendations to states like Florida and Texas about, look, this is working, this is not working, how can we improve it?
Well, it's exciting, and we appreciate your good work, and thank you for taking the time to tell us about it today.
You're very welcome. Take care, Scott.
He is Professor Frank Catalanato. He is a professor of pediatric dentistry in the College of Dentistry. I'm Scott Drake, and you're watching the Dentist News Network.